Alessandro, I know you have also some experience with traction device, and one we didn't mention yet is the Lumen system, which was actually developed as a stabilizer in the colon, but is also used for traction. What are your experience?
So let's go ahead with the stabilizer. So this is a device that's been introduced a couple of years ago, but there are also other systems to keep, especially the colon, very stable into the operating field. You see there is the double balloon or the single balloon technique. And there is also this new AGI scope from Fuji, which has a balloon on the tip of the scope, which is very helpful to have the scope stable over therapeutic procedures. Now we want to show the concept of Lumendi. Is an over tube with the two balloons, one front balloon and one rear balloon. The front balloon can be advanced and can contribute, once both of them are inflated, can contribute to create what they call the therapeutic zone. Therapeutic zone stabilizes the colon, the scope, and also the use of any endoscopic devices, and may help in preventing colon slipping, the spasm, and of course the translated much better control of what we're doing during therapeutic procedures. So this is how the system works. Once the two balloons are inflated, you can use air or water or whatever you want, and you create your own therapeutic zone. And at that point you may also consider to advance a little bit more the rear balloon to stay closer to the lesion. But in general, the concept, you are creating a specific therapeutic zone where your movement will be more stable and more controlled. These are two cases that we want to show. One is a recurrent lesion after several attempts of resection into right colon that was very difficult to be approached, and at this point using this device helped so much in looking beyond the lesion, making proper injection, and elevating and afterwards starting the dissection. We knew from previous histology there was high-grade dysplasia lesion, so the aim of this resection was to have the polyp in a single piece. As you can see in this demonstration, the scope is extremely stable, and I'm having very good control of the hybrid knife. And at a certain point we also use the front balloon to get some traction of the lesion. This is very important, as has been said before by the Japanese expert. There are part of the procedure where traction can be very helpful to expose the hidden submucosa that otherwise cannot be reached easily, even though you are using any kind of cap. So now we are using this concept that we are tractioning nicely the submucosa, even though we are in an area of a lot of fibrosis because of the previous treatment. You can appreciate how much was the fibrosis at that level, even though we're using the water jet, we cannot elevate too much. And again, the control of the movement is very good and very precise, and this can allow you to complete the procedure safely without any pressure. So the other case I want to show you is this big lesion again to the right colon, and this is to show how the inflated front balloon can be used to help in moving the polyp towards the scope and allowing a safer and also much better resection, because the exposure of the area to be resected is much better and more clear using just the stabilization and the balloon that we have inflated the front balloon. So there are a lot of data on this, and this is the latest publication. Huge study, 111 patients. They compared Lumendi assisted procedures versus standard ESD. Even though it was not statistically significant, the authors were able to show there was a trend towards increased and blocking curative resection using the Lumendi technology at the platform zone.